Hi everyone, welcome back to my channel. In today's video, I want to talk about my dental hygiene, as weird as that sounds. It's quite a random topic, but I've actually gotten this question a few times in my comment section about my dental hygiene, and the past two videos I filmed were a bit more serious, somewhat financy related topics, and I think with those topics I felt like I needed to be a bit more serious and careful about how I word things, which is very hard when you're just talking live without a script. But in today's video, I just wanted to do something a bit more lighthearted. I'm trying not to take myself too seriously, even though dental hygiene is kind of a serious topic. But it's also kind of in the realm of hygiene and self-care, and those are also topics that I really love to talk about, and I find much easier to talk about naturally. So that is the agenda for today's video. It does feel slightly awkward talking about this because I kind of feel a bit like own self praise own self, because I'm saying here's how I get my teeth white and clean. Like, I'm assuming they're white and clean, but who knows, some of you may disagree. But since I've gotten a couple comments about it, and it is also something that I kind of like talking about, so that's the reason for today's video, and I hope you enjoy. Maybe we can start with the most common comment that I get about my teeth, and that is the question of how I get them looking so white. Firstly, thank you for that comment. It's really sweet that you think so. And I guess objectively, when you're seeing them on my videos, my teeth do look quite white. When I'm editing myself, I also notice it. But I think the main contributing factor to that is that I film in front of my window in my living room. So I'm sitting directly in front of the window where the sunlight comes in, and I'm pretty sure that's 90% of, or maybe even 95% of what is contributing to my teeth looking very white. Because I have a regular mirror in front of me, and when I look in the mirror, I can see a yellowish tinge, like a natural yellowish tint that everyone kind of has in their teeth, because unless it's fake teeth, there are very few people with purely white teeth. Like, teeth has to have some yellow in it naturally. And I don't go in and whiten my teeth in post or anything. It's truly just the way the light hits my teeth, and maybe the way that my camera processes color, because I don't do any sort of filtering or post-color processing on my videos when I'm editing them. And also when I'm outdoors, I do think my teeth look a bit whiter, again because of the natural daylight and the way the light reflects off my teeth. And looking in the viewfinder now, I do see that my teeth are whiter than when I look at myself in the mirror in front of me. So maybe there's something in the camera as well that whitens the whites a bit more. I just wanted to say that up front first, because I think if you were to see me in real life, my teeth don't look as white as they do in my videos, because there's just something about the way that the camera processes the whites, and so my teeth do look whiter on video than in real life. But that being said, I also do certain things in my routine that make them more white than yellow. So perhaps they are whiter than average, but they're not like pure white. It feels really awkward saying this. I'm sorry if I sound very braggy, but I'm just trying to be helpful and transparent about what I do, in case you want to kind of do similar things to get whiter teeth yourself. So please bear with me. But what I do is I also whiten my teeth with whitening strips. This is the one that I use. It's the Oral-B 3D White. I used to use the Crest whitening strips, like the American brand, but I think Oral-B and Crest may be the same company. Like, either one or the other bought the other company. And so even if you Google Crest 3D strips, the packaging looks almost exactly the same except the branding. So I think they may be the same company, just different names in different markets, but I can't be sure. I've been using whitening strips since 2014, but I don't use them frequently. I use them maybe every couple years, because the effect does last, for me at least. And also, I don't think it's very healthy for your teeth to use whitening strips very often. So I think every 2 years is a good way to space it out. I'll talk more about my whitening strips later, because now I'm just trying to explain why my teeth look the way they do on camera. So as I've said, the first one is just that the way I film and the light hitting my teeth makes my teeth look brighter, and also the fact that I do use whitening strips, so my teeth are whiter than average. And finally, the reason why my teeth are so straight is because I got Invisalign. So I think those three things in combination make up for the effect that you see on camera. And that's it. That could be the entire video, and you can stop watching here. because everything that I'm going to talk about from now on will be quite perhaps obvious things. I'm really just going to talk about toothpaste and floss and basic dental hygiene that is not a secret or anything. In fact, nothing on this video is a super secret thing. But if you don't mind hearing me talk about dental hygiene, then I hope you continue watching. As lame as it sounds, I am quite passionate about dental hygiene, and I have a very specific routine that I do every single day, twice a day. And I think that contributes to the overall health and look of my teeth. Although I have to emphasize that the aesthetic appearance of my teeth or anybody's teeth is really secondary to the hygiene aspect. If you have the straightest, whitest teeth because of, say, Invisalign and whitening treatments, but your dental hygiene is poor, there's only so long that you can sustain the aesthetic look of your teeth until your bad hygiene catches up to you and like maybe your teeth start falling out or you get gum disease. So I think it works hand in hand, but you should always prioritize dental hygiene over aesthetic treatments. I think that applies to many things in life as well, not just dental hygiene. And so that's what I want to talk about now in this part of the video. And I have a lot of things that I want to show you, although nothing is truly very fancy. Everything I probably got from Venus Beauty as usual, or some small things I got online, and I'll show you those. So let's start with that. First and foremost, maybe I'll talk about my toothbrush. So I have two toothbrushes. I have my electric toothbrush. This is by far the most expensive product that I have in my dental routine. This electric toothbrush cost me maybe $100, and I got it maybe in 2022, so it's been almost 3 years since I've been using this. And then I have a regular toothbrush. This is just a regular toothbrush that I think I may have gotten from Venus Beauty. With a regular toothbrush, I'm really not that fussy about the brand. I always switch because it just depends on what's available or what's on sale. But what I always prioritize is extra soft bristles. And also, like, the toothbrush head cannot be too small, because I know the Japanese toothbrushes are very popular, but they have such a small head that it makes brushing a very slow process. So like a normal medium-sized brush head is also what I look for. But extra soft bristles is my main priority because tougher bristles are quite hard on your gums. My electric toothbrush is just the Oral-B brand. I think Oral-B makes really good dental hygiene products. And this is the circular brush head. This one has the pressure sensor, so it can tell if you're pressing too hard on your teeth. And it also has a timer, so it runs for 2 minutes and then it beeps every 30 seconds to tell you that you should switch the area that you are brushing. So I really like that about this toothbrush. It also has an app. Not that I ever use the app. I think I just use the app to keep track of when I last changed the brush head. I don't know what else to say about these toothbrushes except that I really like them. And there's a reason why I still have two toothbrushes, one electric, one manual. And that's because I only use my electric toothbrush at night. So in the day, when I'm brushing my teeth in the morning, I use just the manual toothbrush because I usually brush my teeth right before I sleep. And so I feel like my teeth don't need the kind of high-powered cleaning in the morning. And so I just use a regular toothbrush. And I also use my regular toothbrush to brush my tongue. I guess among all my tips, that might be the less common tip, that you should brush your tongue. And I know they sell tongue scrapers and everything, but I've personally never used any of those tongue scrapers because I find a regular toothbrush works just as well. And I've even started putting toothpaste on my toothbrush and then brushing my tongue with toothpaste. And the point here is that you want to be really gentle. Basically, you're just trying to get like the layer of food, and you know, like you just accumulate a layer of stuff on your tongue at the end of every day just from whatever you happen to eat that day. And so brushing my tongue has eliminated a lot of issues with bad breath and overall just makes my mouth feel cleaner. So if you don't brush your tongue, I highly recommend trying it out because I feel like 80% of bad breath comes from the tongue, not from teeth. Try it out, and just try it out with a normal toothbrush, and remember to be very gentle because you don't want to like hurt your taste buds or anything. So yeah, I've been doing that since, I don't know, in primary school. Like in primary school, I figured out that if you brush your tongue, your mouth will feel cleaner, and I've just done it ever since. And I'm always very surprised that not more people do that. Like, don't you think your tongue is also just as dirty as the rest of your mouth? So please brush it, and brush it gently. That's why it's important to get a soft bristled toothbrush. The electric toothbrush is optional, I guess, but I really like it. But I don't bring it when I'm traveling, I just use a regular toothbrush when I'm traveling. So that is about the toothbrush that I use. The next most important thing I'll talk about is actually floss. So flossing is something that I've only picked up in recent years, maybe in the last 3 years. And that was because I started Invisalign and I really wanted to get my teeth as clean as possible. And so I started flossing regularly ever since then. Because previously, up until I was maybe 25, I never flossed. Like, it was never something that I thought was convenient to fit in my routine. And I thought just brushing my teeth was sufficient anyway. And this floss is the floss pick kind. It's this one. It's not the floss string that you pull out from the little box, because I've tried that before and I think that whole thing was what turned me off flossing, because I thought it was very troublesome. I couldn't really maneuver the string well. But when I started using floss picks, that was when I started flossing more regularly, because floss picks are far easier to use. In the hierarchy of like floss superiority, there is the regular string floss, that's the best one, and then there is floss picks, and then there is like the water flosser. But I've watched many dentist videos on YouTube and read up like different articles about it. I think they all generally agree that you pick whatever makes you floss the most. So if you can't stand the idea of using a floss string or floss pick, but you can use a water flosser, just stick with the water flosser. Like, whatever makes you floss your teeth, stick with that tool, even though it might not be like the best tool available to you. And that's me with floss string. So I really don't like using the floss string. I really like using a floss pick. And so this has helped me floss regularly for the past 3 years. And my ultimate favorite one is this brand from Guardian. This is the Guardian floss pick, and specifically the flat thread. Let me show you how the floss looks like. They have the round thread as well, but I prefer the flat thread. I mean, I don't know if it helps in flossing better, but in my head I feel like it catches more surface area, and so it just feels better to me, so I prefer the flat thread. But I'm not sure if there's any real noticeable difference. Let me talk about flossing for a bit, because I know it's not many people's favorite aspect of dental hygiene, and I'm pretty sure most of us actually don't floss. We just brush our teeth. Not that I'm saying brushing your teeth doesn't do anything, but at risk of coming across very naggy, it is important to floss. I think I read somewhere that the gaps between your teeth that your toothbrush can't reach is about 40% of your total surface area of your teeth. So imagine if you're not flossing, you're not cleaning 40% of your tooth surface area. It seems a bit high. My percentage could be wrong, but I remember watching a Teeth Talk Girl video. She's one of my favorite dental hygienist YouTubers. I think she said 40%, but I could be wrong. So the gaps between your teeth, even if you think there is no gap, as long as a thread can pass through, it is a gap that can be clean. And that's what floss is for, because your toothbrush can't fit through those gaps as you're brushing. And think about it, like all the food that gets stuck in between those gaps every single day, that's why I have floss in my office. Because say I'm eating like a chicken kebab from Stuffed, all that chicken will get stuck, especially in the back of my teeth, and it would drive me crazy. I have to floss my teeth after I eat something like that. Something that I know will get stuck in my teeth, I have to floss afterwards. So I carry floss around in my bag as well. If I'm eating at home, I'll also floss after lunch. So I floss maybe once or twice a day. The only time I don't floss is when I brush my teeth in the morning. But after lunch, I will usually floss if it's convenient to do so. And then at night, when I'm brushing my teeth at night, I'm definitely flossing. So maybe you can start with just flossing once a day at night and try to build that habit. Because I think once you see just how much food can get stuck in between your teeth, you can't unsee it, and then you'll feel like your dental routine is not complete without flossing. Trust me. So from being someone who never flossed in her life to being a regular flosser, I think it has kind of changed my life. I think flossing is just as non-negotiable as brushing my tongue at this point. Okay, now I'll talk about the toothpaste that I use. I have two, but the toothpaste that I've always been using is this Colgate Advanced White toothpaste. I have my name on this toothpaste because I brought it overseas and I didn't want my toothpaste to get mixed up with everyone else's. This one that I'm showing you is just a travel size. I do have the bigger size that's in my bathroom. And the reasons why I like this are not that deep. Firstly, I can get it from Venus Beauty. I think you can get a pack of 3, so 2 big ones and this travel one, for $4 if I'm not wrong. And I try to use a whitening toothpaste because I do want my teeth to be a bit whiter, but I've always wondered if any of the whitening toothpastes are better than just a regular toothpaste. Uncertain, but I just use it anyway, and I like the flavor of this. So really, it's not like a life-changing thing. If I couldn't get this anymore, I wouldn't be that upset. I'll just find another affordable whitening toothpaste. Other than that, I also like the fact that this is a flip top, because I know some toothpaste is like a turn top and then you have to turn it back in. So I can't deal with that. I just want something that I can easily open and close. That's like the other necessary criteria for my toothpaste, I guess. So that is my regular toothpaste. Or it used to be my regular toothpaste, because nowadays I've been using the Sensodyne. This is the Sensodyne Gum Care toothpaste. It's a sensitive teeth toothpaste, so it's specifically for people who have sensitive teeth. Like when you drink water and then you get a sharp pain, that kind of sensitivity. And I've rarely gotten sensitive teeth in my life, but in the last 2 months, I've been getting like a sharp pain every time I drink cold water, like iced water, which really bothered me. So I went to the dentist and we did an x-ray, and she said there's no cavity, but try just using sensitive toothpaste for like 6 months or something. And I actually think it was because I was using my whitening strips just recently. I'll talk more about it later, but that's also why I said don't use whitening strips so often, because it can cause tooth sensitivity, and I think that's what happened to me last month. So I've had to switch to a sensitive toothpaste in the meantime, maybe even for the long term, but thankfully it's not like that much more expensive than just a regular toothpaste. I think this one I got from Venus Beauty as well. The main difference is that the sensitive toothpaste, and I don't know if it's just Sensodyne, it doesn't foam up as much as a regular toothpaste, so it's not as satisfying to use to brush my teeth as a regular toothpaste. So I do miss my regular toothpaste. And this one I just got in the Gum Care line just because, but they have like a whitening one as well and like a cavity protect. I'm not really sure. All these things I feel like don't really make much of a big difference. It's really just your personal preference and something for you to choose between different versions. Maybe it's a Sensodyne thing that it doesn't foam up. I might try other sensitive toothpaste once I'm out of this one. I think Colgate has a sensitive line as well. And it really does work. I feel like my teeth do feel slightly less sensitive than if I were to use a regular toothpaste. Even if you don't have sensitive teeth, you can use sensitive toothpaste. Because what sensitivity is like there's a bigger gap in the pore of your teeth. Because teeth are quite porous, so there are pores in the tooth where things can like go in and make your nerve more sensitive. So sensitive toothpaste has a chemical that helps to fill those gaps and help to prevent your teeth from becoming as sensitive. I think. That's just what I read. So it's nice that I have it, but I do miss my regular toothpaste. And I hope that the sensitivity goes away soon. Thankfully, it's only from very cold water, and it's because I have a habit of swishing water around in my mouth, and so when it touches that particular spot, that's when it gets sensitive. But if I were to just drink normally, then it'll be fine. Another thing I have to say about toothpaste, I had a phase where I was trying to be a bit more eco-friendly, and so I was trying out the toothpaste tabs. So if you've never heard of a toothpaste tab, it's basically like a mint that is supposedly a toothpaste. And how it works is that you bite into it and then it mixes with your saliva and then it becomes a paste with which you can brush your teeth. You will usually see this kind of thing in like those eco stores, and it's better for the environment because they don't have water content and they're far more compact to transport compared to like a regular toothpaste where a lot of it is just water to make the paste. But the problem with those toothpaste tabs is that a lot of them don't have fluoride, firstly. So another thing I always look out for in the toothpaste is fluoride. So if it advertises itself as like fluoride free or whatever, I'm staying away from that brand. I really want fluoride in my toothpaste because fluoride is what will protect your teeth from cavities. So those toothpaste tabs oftentimes don't have fluoride. Again, because they tend to be from brands that are like green and organic, and so they see fluoride as like a dangerous chemical or like a questionable ingredient in household products. Unless you have a real fluoride allergy or sensitivity, then it makes sense to avoid fluoride. But if you don't, then it's really beneficial to have fluoride in your toothpaste. So those toothpaste tend to not have fluoride, and also I feel like they didn't clean very well because when I was using them for like a year, when I would go for my 6-month checkup with the dentist, I would always have plaque. Is that how it's pronounced? Like plaque? I would always have plaque on my teeth that the dentist will then have to scrape off, which is fine because she could still scrape them off, but I was just so demoralized to see plaque building up even though I thought I was brushing very regularly. And now that I've switched back completely to regular toothpaste, that never happens to me anymore. Like having the black plaque build up on my teeth. So after a year of using the toothpaste tabs, I just stopped and I went back to regular toothpaste, and I don't think I'll ever go back to the toothpaste tabs unless they like change the technology or something to make it better. And another thing I'll never do is use DIY recipes for anything related to my teeth. So I will never just use raw baking soda to whiten my teeth. I will never just use regular charcoal powder to whiten my teeth. If say it's like a charcoal infused toothpaste, like they formulated it in the toothpaste, that's fine, but I'm not buying raw charcoal powder, putting it on my toothpaste and then brushing my teeth with it, because that can be incredibly damaging for your teeth. Like the particles of the baking soda or the charcoal are so much bigger that they can actually scrape the, is it pronounced enamel? The enamel on your teeth and make them extremely sensitive and just damage your teeth. And enamel is something that doesn't grow back, I don't think. Like you can remineralize your tooth. I'm not a dentist, so these are just words and terms that I've read, but basically I think all dentists will say don't DIY your own dental hygiene recipe. So avoid baking soda and charcoal powder, like raw ingredients in your dental routine. If it's in the toothpaste that you buy, fine, because they have formulated it to be gentle and suitable for use on your teeth. But if you're just taking it from your pantry, I think you're playing with fire there. So avoid anything like that at all costs. And it's not like toothpaste is expensive. You can get toothpaste from Value Dollar or Venus Beauty for like $2 or something. Alright, toothpaste over. Now we're veering into maybe more optional things or things that might not apply to you. So like for instance, one optional thing is using mouthwash. This is the mouthwash that I use. It's the Listerine Total Care Sensitive. When I use mouthwash is at night as my final step before I put my retainers in. And throughout the day if I feel like I want to freshen up my breath. So I don't use it when I'm brushing my teeth in the morning, but I do use it say like after lunch, after I floss, I feel like I want to freshen my breath a bit, then I'll use mouthwash. And then again only if I'm at home, because I don't have a bottle in the office and I don't carry around mouthwash when I'm outside, so only when I'm at home. I used to use the Listerine Healthy White when it had the lemon and salt flavor, but then they changed the formula for that one, so they took out the lemon from it, and the reformulated one I really couldn't stand the taste of it, so I was very upset that they changed the formula, because that was truly my holy grail mouthwash for years and years. And so when they reformulated it, I had to find a new mouthwash that I liked, and this was the one I ended up with. This one is the sensitive one because it doesn't have alcohol. Just the regular one without the sensitive is extremely minty, and I don't really appreciate that feeling because my mouth feels very dry afterwards. But the sensitive one I think has a lower concentration, or maybe no alcohol at all, so it doesn't have that very cooling, drying feeling, but it's still refreshing. So I really like the sensitive one. And this one has fluoride as well, because previously I was using the Cool Mint Less Intense, but that one didn't have fluoride in it, and so I switched to this one which has fluoride. When it comes to the products that I use for my dental hygiene, I tend to like using the same things over and over again because I know that they suit my preferences. Like this toothpaste, that mouthwash, I tend to just buy the same thing if I know that I like it, because I don't really care to experiment with different products for my dental hygiene. And it saves a lot of time thinking and trying out different things, and then potentially having it not work for you and then wasting the product and the money that you spent on it. So I just tend to buy the same things over and over again. So I will continue buying that mouthwash until they change the formula or something, and then I hate it and I have to find a new one. Okay, nothing much else to say about my mouthwash. Maybe I'll talk about my retainers. So this would apply to people who have had braces or Invisalign, or you have like a night guard that you wear. You would want to keep your retainers or your night guard as clean as possible because they are meant to sit on your teeth for the whole night, which is an extended period of time, and so they can get grimy and dirty, and you wouldn't want to put something dirty on your freshly clean teeth. So keeping your retainers or your night guards clean is very important. So how I do that is I use this retainer cleaner. This is just the Polydent version for retainers. I think they mostly do denture related products, and I'm not sure if you could use the denture cleaner as well because it would be cheaper than this specific retainer one. I've just never tried. I think the denture one is a green tablet, but this one is a blue tablet. So I usually buy this in bulk on Shopee when there's a sale. So I try to get one box for maybe $7 because otherwise I think one box is almost $10. So if you can get it on sale, I would bulk buy. But also be mindful of the expiry date. One box has 36 tablets, but I only use half a tablet each time. So this box can last me 2 months. This is how it looks. I usually just cut them up and then put it in my cabinet. And I can use one tablet over 2 days. Like, I'll break it in half and I use one half. And I put it in this case. I got this from Shopee. It's not very expensive. At most, maybe $10. And that's my retainer, if you can see. I mean, there's not much to say about it other than it's functional and it's pretty, because there are much cheaper ones that you can get that look a bit more plasticky and cheap, but this one is slightly more expensive, like $10 or $12, but it looks nicer on my sink. And it has this tray, so this is a tray with holes at the bottom, but I tend to just keep it in there. And I'll soak my retainers in the retainer cleaner for the whole day until nighttime when I have to put them back in. So my routine with this is in the morning I'll wake up and then I go brush my teeth. I take out my retainers, I rinse the retainer, I rinse the box also, and then I put the retainer cleaner and I fill it with water with my retainers in, and I let it sit there the whole day. So at night, when I'm brushing my teeth before I sleep, I take out my retainers, I brush them gently with my toothbrush, just with like the water that's already in here, and then I put them in. So whenever the retainers are not in my mouth, they are sitting in the retainer cleaner water. And that's how I keep my retainers clean and without any buildup. Because I've heard from friends that their retainers eventually get this like white buildup, which I think are like the minerals from your teeth or from the toothpaste. If when the water evaporates, the minerals are left behind and they calcify on your retainers. So to prevent that from happening, your retainers should be soaking in water, preferably with a retainer cleaner, and that's how your retainers can last for a long time so that you don't have to keep changing them. Getting a replacement retainer is really expensive, so ideally you would want to use it for a long time. Let me know if you think I'm doing it wrong though, because that's what I do. I just soak my retainers in the water the whole afternoon. But is that something you should be doing, or should they preferably be kept dry? Because they're just technically plastic after all. Like, I don't think they will break down in water, and the retainer cleaner is just, I think, what is it made of? It's mostly baking soda with some stabilizers and everything. So, I don't know. But I've been using this since I was wearing Invisalign and then for my retainers, and it works really well. Okay, one of my last few things that I want to talk about is maybe my breath mints. This is quite random, but in case you want to freshen your breath throughout the day but you can't brush your teeth, eating mints or like using a breath spray is the best thing that you can do. I've shown this before in my what's in my bag, so this is for when I want to freshen my breath very quickly. But if I want to eat something, then I'll have a mint. There's actually a specific kind of mint that you can eat that is actually good for your teeth, and that is xylitol mints. I'm not sure if Eclipse have xylitol in them. Also, this one I got from Korea, so I can't tell if there's xylitol in it. But after I finish my Eclipse mint, I might go for specifically a xylitol mint. So xylitol is a type of sugar, but it's actually good for your teeth. It's not like regular table sugar. And it's also used as an ingredient in some toothpaste and mouthwash. So try to get sugar-free xylitol mints if you're looking for mints to eat throughout the day or to freshen your breath. I'm actually quite sensitive to bad breath, and I really hope that I never have bad breath or talk to somebody with bad breath, because it's just uncomfortable for everyone involved. Especially if you feel like you know your breath is not the freshest. And so I'm quite paranoid. I will carry breath spray and mints around, and I try to eat them the moment I feel like maybe my breath is a bit stale. But remember to brush your tongue. That is like the surest way to reduce the occurrence of bad breath. I guess the final thing is my whitening strips in terms of the products that I use for my teeth. I mentioned them at the beginning of this video. I've been using whitening strips since I was in junior college. I think my second year of junior college I discovered them. And I remember before I used whitening strips, like my teeth were just average color. Like they were not super yellow, but they were not white. They didn't really stand out. But I remember after I used my whitening strips, suddenly people were asking me why my teeth were so white. Like, it was a really dramatic difference from before I use them and after I use them. Like even my parents asked me why my teeth were so white suddenly. So they do work, and they work really well on me at that time. So ever since then was when I started getting comments on my teeth being white, and I would use them sporadically again throughout the years ever since then, but by then my teeth were already white, and so they didn't really make that much of a bigger difference from the first time I used it. Oh, but how you're supposed to use this is there are two strips, like for your top teeth and your bottom teeth, and you put them on between 30 to 60 minutes every single day for 2 weeks. So it's usually a course of 14 days, and that is considered one course of whitening. And when they say do every 2 years, they mean do those 14 days every 2 years. So it's not like you're using one every day for the rest of your life or something. I don't think you should do that because it could really make your teeth very sensitive. They have slightly changed over the years. So the ones that I have right now, it says use once a day for 60 minutes. Back when I first used it, in fact, like up until this point, it had always been 30 minutes. But then now they've increased it to 60 minutes. I suspect they made it slightly gentler so there is less sensitivity, because that is one side effect with using whitening strips. You can get sensitive teeth because it whitens with hydrogen peroxide. That is not to say you should go out and buy hydrogen peroxide and use it by yourself as mouthwash. That is another DIY thing that you should not do that I have seen going around on YouTube shorts. Please don't do that. Just go with something that has been formulated for you. So the last time that I did a full 14-day course was maybe in 2019, or maybe that was even like a 10-day. I don't think I've ever done a full 14-day course again ever since the very first time I did it when I was 18. Until this year, I bought another set of 14 so that I could do the full course, and then I stopped at 11, so that's why I have 3 more, so 12, 13, 14. I just stopped at 11 because I felt like I had already seen the results I wanted to see, and so I just stopped. And even then, that's when my tooth sensitivity started. So even for somebody like me who is kind of seasoned, I still can get tooth sensitivity. I think my straightening procedures also contributed to my teeth being slightly more sensitive after using the whitening treatments, because back in JC, before I had braces, my teeth were fine from using the treatments, but as I was saying, I think getting braces and Invisalign probably contributed to my teeth becoming more prone to sensitivity, because the nature of teeth straightening is that it has to dissolve your teeth root in order to move them, so I guess that was what happened. So just something to note if you've had orthodontic treatment before and you want to try whitening your teeth, there's a risk that your teeth might be more sensitive to it. Just keep that in mind and always stick to the instructions on the packet. If it says up to 60 minutes, don't go more than 60 minutes. And just be more mindful about your own teeth and how it's reacting to the different products that you're using. So I found that my teeth were always slightly more sensitive the next day, because I tend to use this at night after I brush my teeth and before I sleep. And the next day my teeth will always feel just a tiny bit more sensitive, but if I skip that night's whitening strip, by the following day they would be fine again. So you just have to figure out a pace that works for you, and it's only like a course of 14 days, so it's not something that you have to do for the long term, and you don't necessarily even have to do all 14 days. You could just do 7 days, and if you already see the desired result, then you can stop using, like how I stopped using after 11. So that's about it really for the products that I use. Maybe now I'll talk about dental procedures and things that you would have to go to the dentist to do that you can't do at home. So one very important thing that I do to maintain my dental hygiene is to go to the dentist every 6 months. Depending on the state of your teeth, it can be between 6 to 9 months. So currently I only see my dentist once every 9 months. I think she said it's not necessary for me to see her every 6 months. But my mother has to still see her every 6 months. So it depends from person to person and depends on your dentist as well. I think going to the dentist every 6 months is necessary in order to make sure that you are checking in regularly on the health of your teeth and also doing the kind of deep cleaning that you wouldn't be able to do yourself at home. Of course, you have to maintain your teeth to the best of your ability by yourself on your own, but every 6 months it's good to see a professional to do that kind of deep cleaning for you. If you've gone to the dentist, they call it scaling and polishing. That's what they do in the office. They scale away the plaque, I think. They scale away the plaque and then they polish the surface of your teeth so that they become less prone to having bacteria stick on them, because if the surface is smoother, bacteria is less likely to stick on the surface of your teeth. But anyway, that is a very important part of my dental health routine, going to the dentist. And before I found my current dental clinic, I didn't really have a clinic that I went to regularly, so I would just call up random clinics and ask if I could do scaling and polishing at their clinic, and then I would just go to different clinics. I think at one point, there was a really nice dentist that my friend recommended near her house, so I would go over to her place and then we would go to the dentist together every 6 months. That was shortly before I found my current dentist who lives closer to me, and again, it's a recommendation from a friend. I mean, going to the dentist is never fun, and I know a lot of people have dental anxiety and they really hate going to the dentist, but with this kind of thing, I think finding a good dentist that you can trust and that has good bedside manner is part of what makes going to the dentist less of a anxiety-inducing situation. I've been to many dentists in my life, and I've also seen many doctors in my life, and there are just some dentists who have very poor bedside manner. They're almost just there to do their job, and they don't really care about how comfortable you feel in the chair. Speaking as just like a patient, I do really prioritize the dentist's relationship with me and whether or not they have good bedside manner and how comforting they are, how empathetic they are. So I think my current dentist, who was a recommendation from a friend, I think she's really fantastic, and I even bring my mom to her because I trust her that much. So I'm really glad that I found her, and she also keeps a chart. And I feel like this is something that most clinics should do anyway, but in all the random clinics I've gone to over the years, none of them really made the effort to keep like a chart or a file of me. Whereas this clinic that I go to with my current dentist, she has a file of my teeth and she keeps track of, say she finds a cavity here or a hole here. She keeps track of that on some file that's on her laptop, and she'll bring it up to me and review it with me each time I come to her office. I was quite surprised when she did that, but at the same time I thought, this makes sense. Why wouldn't a dentist do this? So I questioned why all my past dentists didn't have this kind of system of review with their patients. Mine is a private clinic, by the way. I've always gone to private clinics because last time there was a CHAS subsidy, so I would always be able to get my teeth cleaned for either free or maybe $20. But then now that I don't have the CHAS subsidy, each time I go it's about $150, which is quite steep, and if you're going twice a year it would be about $300. But honestly, I think it's worth it. If you can claim from company, that's great, but even if you have to pay out of pocket, if it's within your budget, I highly recommend going to the dentist to get your teeth cleaned. And you don't have to go to a private clinic like me. You can always go to the National Dental Centre if you're willing to wait for an appointment. But if you schedule your appointment in advance, which is what I do also, then you always get an appointment every 6 months. So figure out a way to fit this into your life and your budget, because it'll make a huge difference in your dental health if a professional is able to assess the condition of your teeth. Because you can do everything in your power to maintain a good dental hygiene routine, but sometimes cavities just form spontaneously. It might not be something you did in the recent past. It might be just accumulation of things that have happened over like decades of your life. So it's good if you can get that sorted quickly, like get your fillings before it turns into something that you have to get a root canal for. For dental hygiene, prevention is always better, and that's why I really advocate going to the dentist, and I really hope you find a good one. I will link my dentist in the description below. I hope she doesn't mind. She doesn't know I have a YouTube channel, but it's the dentist that my friend recommended to me anyway. So if you're curious and finding a new dentist, I will link her profile below. And with that, I think that's the main message that I want to convey in this video. I started this video with talking about why my teeth look so white and straight and the procedures that I've done that contributed to that effect, which I said was Invisalign and whitening my teeth. But again, those are very aesthetic changes. You don't have to straighten your teeth to have healthy teeth. Those are like one-time procedures, but your everyday habit of brushing and flossing is what will maintain the health of your teeth. And that is really the outcome that we should be working towards, which is having a clean mouth and the preservation of our teeth and gum health throughout our lives. Not just for them to look nice. But at the same time, I also understand that if straightening your teeth and improving the aesthetic appearance of them is what will motivate you to take care of your teeth better, then I do think it's a worthy investment. Orthodontic treatment is not cheap, but if you think of it as an investment in your health, in your well-being, in your confidence, then it really might be worth it. Personally, I've never had the healthiest of relationships with my teeth in terms of how I feel about them, how I think they make people perceive me. Growing up, I actually had a lot of anxiety and self-confidence issues surrounding my teeth because I've always had big teeth. They are still big now, but when I was younger, they were much bigger because my face was smaller. And before I got braces and Invisalign, they were more protruding than they are now. I always felt like I had a horse mouth. And I remember once when I was in primary school and then in mother tongue class, and my teacher was playing this game where he was trying to guess what we would be, what he thinks we would be when we grow up. So when he came to me, he said immediately, "I think you'll be a dentist." And my first thought I think I was 12, my first thought as a 12-year-old was, is it because my teeth are big and so obvious in my face? And so I was not at all flattered by that comment, and I still remember it to this day. And so I've always been very self-conscious about how big my teeth were, how much they overwhelmed my face. And because they were so big, they were more obvious in their irregularities. So when I whitened my teeth for the first time in JC, that was really the first time that I can remember getting compliments on my teeth because they were white. Back then, I hadn't gotten braces yet, but my teeth were still relatively straight, at least the top row. And that's really what most people see. My bottom row was a bit more irregular, but most people couldn't see anyway. It was only in uni that I got braces, and then when I started working, I got Invisalign for a short time just to re-straighten my bottom row because I didn't wear my retainer. Because back then, after I got braces, I got the metal retainer, which is really the worst kind of retainer because your teeth can still shift. But after I switched to the plastic retainer, now I feel like it's much easier to maintain the nightly retainer wearing because they're far more comfortable to wear. But anyway, what I'm trying to say is that back then, I really had a lot of insecurity surrounding my teeth. In fact, of all the things I was insecure about with regards to my appearance, my teeth was probably 50% of it. But I think over the years, the grip that insecurity had on me had just faded slowly as I've gotten older, as my priorities have changed. And also because I've had orthodontic treatment, so I've worked towards like fixing the issues that I was feeling very insecure about. And at the same time, I also feel like there is only so much I can change. Even though I whiten my teeth, I've had Invisalign, my teeth will never be perfect to me. There's always something to nitpick about, something that I will be unhappy with, but there is only so much I can change. So at some point, I just had to let go of some of that anxious feeling that I was feeling and just let it be and accept that I've done what I can. Like, I can only internalize so much before I feel like, what's the point? I'm just making myself feel worse. So that's where I stand now with regards to my teeth. I feel like I'll do what I can. I'll maintain my dental hygiene routine. I'll go to the dentist. But as for their aesthetic appearance, I can't change the size of my teeth, for instance. The large size of my teeth has always bothered me, but barring going to the extreme of getting veneers, I can't change the size of my teeth. So this is as much as I can do to create the kind of appearance and health that I'm happy with, and that's it. So what I'm trying to say is, if you're similar to me and you have these insecurities, once you feel like you've done the most that you can, then I think it's okay for you to just accept that you've done your best. So that is my dental hygiene routine story. Somehow I managed to talk for 1.5 hours about my dental routine. But regardless, I hope you enjoy. I'm worried that I forgot to talk about something, but if you have a question, please ask me in the comments below. I don't know who would be interested in this kind of thing, but regardless, I hope it was helpful. I hope you got something from it that you can apply in your life. I am thinking about doing a body care video, so I'll talk about my body products and my hair products and stuff. Again, no special secret. I just wanted to share the stuff that I use in my own life. But that's a video for another time. Thank you for watching, and I'll see you in my next one. Bye bye!